Studies have shown that if you take a physically inactive person and you make them a physically active, so basically the good way to think about is like decrease their sitting time to less than 4 hours per day total, okay? So if you do that, the risk of all-cause mortality decreases by 20%. So let us say example that you have, let's say you have a diabetes, okay? So the diabetes increases risk for heart disease, and the heart disease causes an heart attack, and then patient dies. So you know that if you're physically active, you could have prevented diabetes, which in turn could have prevented heart disease, which in turn could have prevented heart attack. So let us say you are weak by not being physically active, and then because you're weak, you fell down. Let us say this is a patient of like 65 years old, and let's say this patient was physically inactive, which means that her bone health was probably not in a good shape. So then she has a fracture, and that fracture relates to disability, and this disability relates to a clot in the lung that results in death. Again, this all stems to physically inactivity.